My name is Dr. Beverly Anderson, and I am the Clinical Director of the Metropolitan Police Employee Assistance Program in Washington, D.C., and it is a wellness program as well as a counseling program and a crisis intervention program for our police officers and our police officials and their families. You know, the Center for Public Safety and Justice, I think, is just an enormous addition to what was a vacuum before. Public safety in the United States, law enforcement in general, is a profession that, while we select really good people, we don't always take good care of them. And because it's such an isolated profession, it's not a good thing. And it's not a good thing to be so isolated. And so for this center, what we are doing is crystallizing the importance of this profession and bringing about changes and advances that have before now not happened. After 38 years and being a part of a member of a law enforcement family, this legitimizes and enhances a profession that is second to none. Public servants, police officers are public servants, and this is a new day in policing as far as I'm concerned, and police psychology as well. You know, the role of education in public safety is so vital because when you think about the profession itself, police officers are exposed to man's inhumanity to man. They're exposed to, people don't call police officers to invite them to barbecues. They are invited into the tragedy and the trauma that happens in life. And so what better mechanism than the mechanism of education? Education about people, education about leadership, education about humanity, all of those things. What is more important than that? And I think law enforcement officers have been forgotten in our society as being so much in need of this other side, the enhancement of humanity in general, and policing, and the importance of law enforcement in our society. The advice I would have for anyone seeking to be a leader in public safety is to look at not just selecting good people, but taking care of those people. Law enforcement officers, we do fine with selection, but taking care of the officers that we hire, taking care of them with their physical needs, but their emotional needs. And that brings in the whole notion of wellness. And when I began 38 years ago, police officers they would experience traumatic events and they'd suck it up and drive on. And we know that that is not a good coping mechanism. And so when we really focus in on police officer mental health and wellness and make it a normal part of training in the academy, and I think that we have achieved that in the Metropolitan Police because we see the same percentage of lieutenants and above as we do sergeants and below. So both union and management come together. The police department allows police officers to come to see us on duty. And so it's been institutionalized. It's a normalized part of the police experience in Washington, D.C. And that's what my advice would be. What better place than the University of Virginia to be a leader in enhancing law enforcement in a way that people haven't thought about before. And what better place than the University of Virginia, Thomas Jefferson's school, you know, where the student drives the education, where the professors interact as leaders and the students are, you know, in an apprenticeship. What better place than the University of Virginia? And I think that this is going to change law enforcement in America and eventually law enforcement in the world and how people see law enforcement officers.